Here we are. Welcome again. Thanks for joining our question and answer session for hair pulling or trichotillomania. I'm Laura Santner. I'm a licensed clinical social worker. I'm also a poetry therapist, and I'm located in New York. So I've been working with BFRBs. Hair pulling is a body focused repetitive behavior. So I've been working in this field for quite a long time now. So I'm really looking forward to answering your questions. I'm sorry if you hear the background noise. There is a baby crying, but we'll get through it. Just write your questions in the chat, the question and answer section. I'm going to go over the pre-submitted questions first, and then I will go over your questions right after that. So relax, have some water with you, some tea, a fidget, and I will get started. Okay. So the first pre-submitted question is the cause of hair pulling related to genetics? So research does indicate that some people have an inherited predisposition to BFRBs. However, just because you have a predisposition does not mean that you're going to get it. It's kind of a combination of factors. So other factors that can contribute, for example, include your hormones, your temperament, your age, any potential co-occurring disorders, and environmental stressors. So it's basically caused by a variety of factors that are all interacting with each other and kind of happening at the same time. So just because you have a potential genetic predisposition does not mean you are going to wind up pulling your hair. Okay. So I hope that answered that question. The next pre-submitted question, what is the prevalence between men and women? Is it perceived that it is a woman issue? So hair pulling and body focused repetitive behaviors, they are all equal opportunity. So that means that they affect both men and women equally. They are highly underreported and underdiagnosed. So this often means that there is an illusion that women are more susceptible. It's possible that men are less likely to report that they have hair pulling, um, and therefore you might be seen in treatment a little bit less frequently. So in summary, it affects both men and women equally. Okay. And again, if other questions come up as I'm going over these pre-submitted questions, please just write in the question and answer box on the bottom of your screen. Okay. Is trichotillomania a new condition, and when was it discovered? So this actually has been around for quite a long time. So for example, I looked up the specific dates. um, Basically, it was first mentioned in literature in 750 BC, and then it was first noted and documented in 400 BC. In 1893, a French dermatologist was actually the first to do a scientific report on trichotillomania. Um, and then it later finally became more well known and more worldwide in the 1920s. And there were about 33 articles exploring the different causalities. The Trichotillomania Learning Center, or TLC, that was founded in 1991. So after that was founded, there was a scientific board that was developed, and then the first medication study was in 1997. And many things, of course, has happened since then. So as you can see, it's been around for quite a long time. Let's see. Any tips on how to tell people you have trich? So first off, you don't have to tell anyone. It's up to you if you want to tell someone or not. When you do decide to tell someone, make sure you trust them and you feel comfortable with them and you feel ready. if you decide to tell someone, I mean, it's up to you how you want to do it. You can do it on the phone, you can do it texting, you can do it in person. You choose the time, you choose the place. Just make sure that you're comfortable. So I suggest first explaining to them what it is, what it's called. It has a name. I find it helpful to explain what the urges feel like. So for example, a good way to explain how what the urges feel like is it's kind of like there's a rock in your shoe and you have to get it out, right? Because if you don't, you're gonna have a rock in your shoe. Um, or trying not to blink. It's another common uh, analogy. Um, I like I like to describe it as try to avoid looking at your phone notifications. See how long you can go without looking at your phone. That's kind of like a similar feeling. You can also let the person know that 1 in 20 people have it, so it's more common than they might realize. Um, have information ready or websites available or pamphlets such as trickstop.com, where there's lots of resources, blogs, and webinars that they can refer to if they have other questions. Um, be prepared for them to ask you questions and um, just talk about it, have a conversation. Most people will be really supportive, and um, you might be surprised as you tell them something personal, they might wind up telling you something personal in exchange. If someone does happen to react negatively, which does happen on occasion, if they react negatively, then you might want to kind of rethink that relationship. It might not be the right person to have in your life. Because anyone worth it in your life who's important to you will be supportive. Okay. Will my hair grow back? Yes. So hair is actually quite resilient, and it typically grows back even after years and years and years and years and years of pulling. Um, be prepared; it might grow back differently. It might have a different color or a different texture, thickness. But over time, it will kind of get back into its groove and sort itself out. Um, there at times there are occasions where hair does not grow back. Um, it's much more unlikely, but a sign that it will not grow back is if the area is very shiny. Um, but again, most of the time, it grows back. Okay. Um, when I pull my hair, it comes out easily. Is that normal, or is this because of a history of pulling? So yeah, that's normal. Long history of pulling, it does not necessarily affect the strength of the hair. Hair just grows back at different rates and it goes through different stages of hair growth. So if you're finding that it's coming out more easily when you're pulling, I mean, don't be concerned. If you are concerned, can always consult with a dermatologist just to make sure that nothing else is going on. And if I'm going through these pre-submitted questions kind of fast and you need me to elaborate or go over it again, just write in the question and answer box. I do see there's some questions in there, so I will get to that soon. Why do I pull my hair? So urges typically arrive when someone is overstimulated, such as like you're anxious or you're stressed or you're overwhelmed. And it also happens when you're understimulated. So like when you're bored. And so pulling acts as a way of kind of your body's trying to send you signals to regain balance. Um, you can also look at urges in terms of triggers of having external triggers, things that are going on around you, um, versus internal triggers. So some things are out of your control, some external triggers versus internal triggers, which are more under your control. Um, I also like to specifically think of the acronym SCAMP when I think of urges causes for urges and ways to address the urges. So SCAMP is sensory, cognitive, affect, motor, and place. So things that can affect your urges are the sensory aspect, how it's looking, how it's feeling, for example. Cognitive is what are you thinking? If you're having a lot of negative thoughts and being hard on yourself, it's going to increase urges. Um, Affect, how you're feeling, right? If you're sad or if you're anxious, for example, it's going to affect. Motor, I kind of think of motor as your positioning, right? So if you're in a certain position, you automatically might get an urge. So barriers are helpful to address that. And place, meaning you might get an urge every single time you sit down in front of the computer or every time you sit on the couch in a certain spot and you watch TV. So those are some things, some reasons, potential causes of why you might pull your hair, what leads to urges. Let me see. How can I cover my bald spots on my head? So besides using things like hats, scarves, bandanas, you can also wear your hair in different styles, kind of change up the part. Um, and also wigs, of course. And there's toppers and different kinds of clips and things like that. Um, you know, wig hats, wig ponytails. So there's all sorts of extra hair hair helpers you can use as well. There are also products that you can use to color in spots. Um, so for example, there's something called like toe picks, Dermamatch, and different kinds of like root touch up crayons. And they come in sprays, they come in powders, they come in crayons. So that can be helpful depending on how big your patches are to cover that up. And it does hide it pretty well. Also, don't feel like you have to hide it. It's okay if you have spot. Okay. What can I do to block myself from pulling? So barriers is a helpful strategy. It's not the only strategy. There are many, many, many kinds of strategies, but blocking strategies is a good one, especially if you are pulling and you're not aware. It's more automatic pulling. Blocking helps to increase your awareness. So depending on where you're pulling from, things you can use to block. You're pulling again, like hats, scarves, bandanas, swim caps are good, wigs, glasses, long sleeves, pants, stockings. Um, you can even like put rubber bands on your sleeves, for example, to make it harder to pull up if you're an arm hair puller. Um, and you can also use barriers on your fingers, so gloves. They have like these thin cotton gloves, which are really comfortable and nice to sleep in. They also have something called billiards gloves, which are pretty neat, and they only cover a certain, maybe 2 or 3 fingers. So that's pretty neat. Um, they have things called thumb guards and rubber fingertips. And you can also just go with the classic Band-Aids on fingers, or at least these 2 fingers, and Scotch tape. I like Scotch tape. It's more affordable and it's fun to play with. Okay. Um, for people who bite their nails, there is some sort of nail coating that makes their nails taste super disgusting. Is there something like that for hair too? So not that I'm aware of. You can consider using different products like Vaseline, for example, to make it more slippery and slimy. And that will make it a little bit less appealing. You can also use products like any kind of styling gel or spray. That will also make your hair less appealing. You're not going to like the texture. And if you go to put it near your mouth, you're not going to like that. having a product in there. Um, if you're if you are eating your hair, um, that's called trichophagia. So that actually can lead to some serious complications, so such as like intestinal blockages. So if you are eating your hair, make sure you talk to your doctor and let your doctor know. If you are eating your hair, um, think about some other strategies that you could use. So, for example, some people really like chewing on dry spaghetti. I think that bean sprouts is better because they're a little bit stringier. And they also have that little bulb at the end. So those are a little bit more satisfying. You can also wear things like wearable jewelry. That's chewable wearable jewelry. Because there's something about like chewing on that like rubber is pretty satisfying. So just things to think about. What I don't like about coating anything with anything that's bad tasting is that's also like a negative reinforcement, and I prefer and find more helpful to use positive reinforcements. So I don't even like that technique for nail biting, actually. Um, let's work on it in a positive way. Okay. I am a parent of a child who pulls their hair. How can I get more support as a parent? Are there support groups? So, if you're a parent of a child who pulls, we do have a parent program at TrickStop, and I think that's really helpful. It gives a lot of information. It's really education, and it helps you to work with your child, and you're kind of you're learning on your own, but you're also learning together and practicing together. So I think it's really helpful. It's a really solid program. So I do recommend that. That program, however, currently does not have support groups. If there is a demand, though, I mean, let us know. Email support@trickstop.com, and if there is a demand, I'm sure we can make it happen. So besides that, if you're looking for specifically support groups, I mean, you can go on Facebook and join different support groups there. Um, there's one that I typically refer people to is called Tricky Picky Parenting. So that's a Facebook support group. You can also check out um, and the TLC is also just started a parent support group as well. So you can look at bfrb.org and check that out. I'm not sure how frequent their support groups are, um, but check it out. If you want just more information for yourself, check out some of the past webinars that we have on trickstop.com and along with blogs. Just reading more information and getting yourself more informed. Okay, let's see. Are there evidence-based treatments specifically designed to address this issue in young children? So treatment kind of combines a lot of factors and a lot of methods. So, for example, evidence-based treatments for trichotillomania include the comprehensive behavioral model, CBT, cognitive behavioral therapy, DBT, dialectical behavioral therapy, ACT, acceptance and commitment therapy, and HRT, habit reversal training. So treatment is not just one of those things, it is all of those things combined. Treatment with young children is the same. It's still all of those things. So whether you're a young child or an adult, you're still going through all of that. Our program does incorporate all of that. The main difference is you're going to be making it a little bit more fun when working with kids. So for example, when they're working on strategies, maybe consider doing like the reward system, meaning you're rewarding them when they're using a strategy. So regardless of whether they're pulling or not, they get a reward if they're using a strategy. And it's really fun to keep track. If you have like a chart and you have the strategies that they use, and if they use it, you put a star, smiley face, make it colorful, make it fun. So, and also if you're doing self-monitoring with a young child, I would suggest having a physical chart and making it fun, colorful, um, interactive stickers everywhere. So that's the main difference, I would say. Okay. Another difference actually is when you're working with young children, you're not just working with the child, you're working with the parents as well. So it's both educating the parents and helping the parents learn how they can support and advocate for their child. Okay, could you please recommend some therapies that I can practice at home? I find that my symptoms worsen significantly while I'm at home, especially during the 4 to 6 hours I spend working. Yeah, so first off, just being aware that this is a big trigger already puts you ahead of the game, and as a plus, because when you're aware, you can better plan and prepare. So think about activities you can do to re-energize, and to make sure you're giving yourself breaks. When you're working from home or if you're sitting in the same spot for a long time, you got to have breaks. So getting up, stretching, going on a walk, drinking water, maybe have a healthy snack, put some water on your face, or even go take a shower. Those are things to kind of keep you moving, give yourself a break, and time to kind of recenter. Um, Again, when we're looking at strategies, I look at SCAMP. So think of having strategies in each of those categories. So you want to have sensory strategies like fidgets, cognitive strategies like rephrasing your thoughts, um, effective strategies, maybe like breathing if you're feeling really anxious, the motor strategies, so using blocking yourself like gloves or hats. Place strategy, so if you're sitting at your desk, see if you can, if you have a laptop, move your laptop and do work on the floor, for example. If you're sitting and doing your work in the same spot each time, change the spot. Um, so think about some of those strategies. When you might also want to consider, if you're trying these and you're just not getting it or you're having a rough time, I mean, consider joining TrickStop, because then you'd be connected to a therapist, and a therapist can guide you through that and can tailor it to you and to your needs, and of course give you extra support as you need it. So I hope that was helpful. Um, I'm going to actually switch over now, 1 minute, to your questions that are live in this question and answer chat. And I will see what I can do. Okay, so first question that's coming through live right now is, can Trick fully resolve? Um, so yes and no. So Trick is a chronic disorder, so part of it is always going to be with you. That does not mean that it's always going to be active. So you can learn these skills, you can practice, and it can be on your mind, and you can be prepared, and you might never pull again. Um, but thinking about it will kind of always be within you. So it can become activated kind of at any time. It can come and go. So it doesn't quite fully resolve, but that doesn't mean that you're going to be pulling your whole life. Um, hope that I hope that makes sense. Um, it's such a frustrating disorder. Um, Yep, I acquired it at around age 14, my first year in high school. So that's a common age, around like 11, 12, 13, 14. And that's a common age, um, due to puberty. all the changes in your hormones is a really common trigger, especially if you are predisposed and have it somewhere in the family. So yes, common age. How do I stop when I've been struggling for almost 20 years? I'm only 27. Yeah, it's really frustrating. And what's really frustrating about Trick is that it can come and go. So it's not about stopping. When I see people say, I want to stop, I just want to stop, just stop, 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 or stop, that puts so much pressure on yourself. And when you use that word, it, it's not going to work. You're not going to stop because of that pressure. Um, because you're going to be extra hard on yourself when you do have those slips, even if they're a little bit of a slip. So instead, I like to think about it in terms of managing it. So how do I manage when I've been struggling for almost 20 years? That's completely normal. You keep trying, you keep practicing, you use different strategies and connect with a therapist who's trained so you have that additional support. Having someone to help you to be held accountable is really, really helpful. So whether it's through this program, whether it's through a support group, whether it's a friend or family member who you can talk to about it, um, can help. But keep trying, keep trying. People can pull for much longer, unfortunately, but also much less. So it just varies. But don't be discouraged. Keep practicing, keep trying. Lots of skills. If you're feeling like you're stuck and you've tried all these things, you probably haven't tried everything. Go talk to a therapist, join our program, and learn more. Um, so you can make adjustments as needed. So yes, this person says it affected my social life, but then it got cut off because I always did it. Yeah, it got cut off. So yes, it's basically a disorder because it affects and impacts your life. That's what makes it a disorder, right? It's leads to something that you can visually see, and it affects your daily life and makes you feel distressed. So you're not alone. It does affect social life, and it's again really frustrating. Oh, so what would be the best way to begin a prevention process? Fidgets, other ideas. So Um, two parts to this question. So you cannot, there's nothing you can do to prevent it from getting trick. Um, but once if you have trick, what can you do to prevent yourself from pulling? Um, yes, is being aware of your triggers, your situations. So the first step to prevention is actually doing a lot of self-monitoring and tracking and learning about what your patterns are. Once you learn your patterns, then you have a better idea of how you can prepare. So, for example, if it's working sitting in front of a computer, maybe you want to have a lot of fidgets all right out on the desk. Maybe you want to have also a glass of water or hot tea to help to keep your body balanced. Maybe you want to set timers to remind yourself to take breaks. Maybe you want to have post-it notes with some positive reminders and encouraging thoughts. So you want to have a lot of things um, to prepare for certain situations. It just depends on the situation. So that example is just one situation. Okay. If you have a specific situation you want to learn more about, add it in the question answer. Okay. Ah, yeah. Is it common to enjoy playing with the root of the pulled hair? Yeah, that's quite common. Lots of people like playing with the roots. They like looking at it. They like taking it off, twirling it in their fingers, rubbing it on their lips. Um, Yeah, roots can be interesting because they can be different colors as well. So yes, it's common. Um, like I mentioned before, if you are someone that plays with the roots by putting it on your lip, just be mindful to try to avoid not to eat it. Eating roots is not really bad, but I don't want it to potentially like lead to eating the whole hair, which can be potentially bad. Okay. What are the best coping strategies for not pulling hair? So um, there are so many, and I don't think there is a best one, because every strategy is going to work different for each person and depending on the situation. Um, so I don't have a specific recommendation. Um, like we talked about when I mentioned SCAMP before, looking at that acronym and thinking about how you can apply that to you is really helpful. So you can have a variety of coping strategies. So the sensory strategies, cognitive strategies, affective strategies, motor strategies, and place strategies. So combining all of that in different situations is what's gonna help. Okay. Again, if you have a specific situation you'd like to ask about, feel free. But I hope that kind of answers your question. If you want to learn more, again, I do encourage you to join or consider checking out TrickStop because TrickStop is very thorough at going over so many different strategies. And it's not just like you're reading about strategies, it's you're reading about it, you're practicing it, and then you're working with a therapist on it. Okay. Uh, Oh, yeah. So is it common to be really embarrassed at the beauty salon? Yes. Um, yes. Yes. You don't have to be, but yes. Not all beauty salons, unfortunately, know about Trick. It could feel really awkward. Um, TLC used to have, I'm sure they still do, but they used to have pamphlets that you can give to beauty salons for educational purposes. So that was a really nice thing that they did to help spread awareness and education so you can feel less embarrassed. If you are going to a beauty salon before committing to that salon, um, I suggest kind of scoping it out first, asking them if they're familiar with it, telling them about it, not necessarily saying that you have it, but just in general, and see how they respond. Um, See if they have any private back rooms, or some salons do like before hour or after hour cuts. Some salons do specialize in hair loss, so that's another route you can go. Um, but yeah, it can feel really vulnerable going to a beauty salon. It can also feel really good, um, having someone else kind of touch and manage your hair. And that's another, some people find it really helpful to go regularly, um, to help them be held accountable. Um, and just for that kind of routine check-in. Um, but yes, that can be tough. Um, Yep. So I have now developed dermatillomania or skin picking. Are there any correlations between these two? Yes. Dermatillomania and trichotillomania are both BFRBs, body focused repetitive behaviors. Some people just have one. You can just have trichotillomania. You can have just dermatillomania. Most of the time, people have more than one. So yes, quite common. Another BFRB that's common is nail biting or cuticle picking. That's another really common one that often people don't recognize as being a BFRB. So yes, it's totally normal, especially if you're trying to work on managing one. Um, it can pop up in another way. So if you're trying really hard not to pull hair, that urge might still be there and it might wind up coming up as skin picking. Treatment is still the same. But yes, having both is just, kind of doubly frustrating, but common. Does the brain secrete a substance when we pull our hair that we become addicted to? Interesting question. I don't know, but I don't think so because hair pulling is not an addiction. Um, it's kind of similar. There's some similarities, but it's not the same. Um, so there is someone asked this in a previous webinar as well, about the relationship between pulling and addiction. So there is a past webinar that talks about that. So check that out and see what you think. But as far as I know, there is nothing specific that the brain secretes that causes it to be an addiction. But I'm not a scientist, so I'm not 100% certain of that. But from what I'm aware of, no. Hope that answers that question. My daughter has been pulling and has started therapy sessions. When I notice that she's been pulling, how should I address this? I've been bringing it up when I notice it, but I feel like this stresses her out as well. Should I just ignore it and move on? Or is it okay to ask her about it if anything is going on? So I would say that's great that she's started therapy. So she already has someone to talk to. She's got that outlet, a person who's supporting her, and who can offer some guidance. When you notice that she's been pulling, if you see her pulling in that very moment, you can ask, hey, can you help me in the kitchen over here? Or hey, can you take a break right now and help me get this out of the closet? um, or um, or you can even just be direct and say, I'm noticing that you're pulling right now. Is there something you want to talk about? Right? Is everything okay? Can I help you with anything? So kind of keeping it varied and switching it up. So it's not the same thing each time. If you're saying the same thing each time, it's going to be overwhelming and annoying. And she's going to want to hide it. And she's probably going to do it more later on, behind closed doors in the bathroom in her room. If you notice that she's been pulling and it's after the fact, you're not catching it in the act, there's nothing you can really do besides just having a conversation, not bringing direct attention to it, just saying, how was your day? What's going on today? What are some fun things you want to do this weekend? Because if you're noticing it after the fact and you're noticing extra spots, then she's going to feel more embarrassed and that, oh my gosh, you can see you and you're looking. So if it's after the fact, just ignore it. How is your day? What's going on? If it's in the middle of her pulling, then kind of say a variety of things, switch it up a bit. I would say, and keep it varied. Okay. You can even put it on yourself, meaning, oh boy, and being like a role model. Oh boy, I'm feeling antsy being in the house. Do you want to go on a walk with me? All right, let's get some fresh. Boy, I really need some fresh air right now. Can you come with me? All right, so it's on you, the parent, not on the child, and it's still a nice way to distract them and change things up. Okay, hope that was helpful. Have you found hair growth treatments like Latisse, I'm not sure if I'm pronouncing that correctly, to be effective? You know, there are so many different kinds of hair growth treatments out there. So I don't know what's helpful, what's not helpful. I feel like the industry kind of prowls on all the hair loss folks. So I don't I don't know what's really helpful because I think sometimes things are helpful because you want it to be helpful or you think it's helpful, so then it becomes like a placebo effect. So I don't know. I don't know. Um, I don't know. Yeah. Um, what I like about hair growth treatments is it makes you feel like you're being proactive though, and treating yourself kindly. So I think that experimenting with different ones are fine and are great, because again, it's a way that you're treating yourself kindly. Um, and when you're feel like you're taking that proactive stance and you're treating yourself kindly, you're more likely to feel better. When you're more likely to feel better, you're going to pull less. And when you pull less, your hair is going to grow back faster. Um, so I say try different things. As long as there's no other reactions, just make sure they're safe to use. Oops. Okay. Um, oh yeah. So have you aware of research or have personally noticed your urges to pull correlate with times in the menstrual cycle? Yes. Yes, they do. Typically right before menstruation and during menstruation, urges are higher, because yes, our hormones are changing and kind of like extra activated during that time. So yes, absolutely. So if you track and monitor your menstrual cycle, you can see kind of when you're expecting it. And so so that week before you're expecting it, make sure you're using all those extra strategies and being extra kind to yourself. And same with during your menstruation. Um, have those strategies out and ready. Because yes, most likely it will increase during that time. Um, very, very, very common. Mostly, mostly everyone who's biologically female. Um, are there studies regarding the most prevalent type of trick? For example, oh, I pull eyelashes, eyebrows, but is this more or less prevalent than scalp hair, arm, leg hair, etc.? I'm not exactly sure. Um, there is research out there about which is more common. I have seen the percentages. Um, I don't remember which one has the highest percentage. It's either scalp or lash and eyebrows. I think those three are kind of the top ones. I could look up later if you want to email the support at trickstop.com. I can look up later and try to find the exact percentages because I know that they do exist. Um, but I don't know off the top of my head, but I believe scalp, um, it's probably my guess is scalp is the most prevalent, then eyelashes and eyebrows. Um, any arm hair, leg hair, body hair, pubic hair, armpit hair, all of that probably is a little bit lower on the scale. Although if you're male, um, I don't know what the difference, I don't know if the prevalence would be much different because men tend to have more body hair and more facial hair. So men are more likely to pull like from beards. So I don't know the exact percentages, but email the support at Trickstop. I'll look further into that for you. Oh, I don't know the answer to this one either. How long on average does it take to regrow eyelashes, eyebrows, other hair? So, um, I don't know, but it grows at different rates. So it's kind of a hard thing to measure. Um, thing, eyelashes and eyebrows grow back, for example, pretty quickly, compared to head hair, which grows back a little bit slower. Um, but when it grows back, it also doesn't have to grow back as much, as long as head hair. So it's kind of depends on what you're defining as like as regrowing. Um, but I would say eyelashes and eyebrows grow back faster than head hair. Body hair, I think, grows back pretty quickly as well. Um, but it can be frustrating when it grows back slowly. From what I'm aware, there's no way of like really knowing, of how long. And also, if you're like staring at the mirror to look at the regrowth, it's not going to be helpful. It's going to feel like it's growing back faster, when you're not looking. Um, so do what you can to block those mirrors and not look so closely, because the less you look, the faster. Strange how that works. The faster it will seem like it grows back. Ah, yeah. So have you found or seen research that suggests that the Keen 2 looks like a Fitbit and vibrates when you engage in your hair pulling, or similar products is helpful? Yeah, I'm very familiar with Keen. I know the founder, Anila. She's a wonderful person. Um, her Keen habit aware bracelets are really great. What's great about them is if you are not aware. So if you are engaging in a lot of automatic pulling, um, using something like the Keen can really help bring awareness, because it will vibrate, when you're not aware. When it vibrates, you're gonna notice it, and you're gonna be like, oh my goodness, and then you can choose whether or not to either pull or to put your hands down. It can be a little bit complicated, to teach the Keen, because you have to kind of train it and put it in certain positions. So sometimes it buzzes, when you're not pulling, so that can be really frustrating. But they have, support staff that can go through it with you and help you, when you're struggling, and really give you a lot of direction. Um, Keen now has a whole bunch of additional features. I believe they have tracking as well. I believe they have like some motivation things. They might have even started additional support groups. So being a part of the Keen family is really helpful, even if you are aware of your pulling. It's just a nice way of getting additional support. Okay, hope that was good. Supplements versus medications, anything specific that seems to work for most. So, medication question comes up a lot in these, sessions. So right now there is no FDA approved medication for BFRBs, unfortunately. The most promising, and the most researched so far is called NAC, N-acetylcysteine, and that is an amino acid supplement. So that one right now is the, most recommended if you want to go that route, um, for your hair pulling. Medications, they are currently researching a new one that sounds promising. It's called memantine. Um, but there is not enough research yet. So, I mean, if you were to go, a medication route, I would start off with, NAC, because it's a supplement, it's the most researched, it doesn't have a lot of side effects. Um, but talk to your doctor. If you have other things going on besides hair pulling, other medications could be helpful for any potential co-occurring disorders. So for example, if you're taking an anxiety medication because you have anxiety, that might affect your pulling because it's affecting the anxiety. But nothing directly is going to affect hair pulling at this time. Hmm. Are Trick Stop therapists able to write prescriptions for devices, such as the Keen bracelet that might help? No. Um, the therapists do not write prescriptions. We could write letters if there is some kind of letter that needs to be written. Um, but you also don't need a prescription for getting the Keen bracelet, for example. You can just order it. No prescription needed. You don't need any special permission or prescription. Just go to their website and order it. So can low mood or depressive episode be related to a trick flare? Yes, absolutely. Right. That would be when we're looking at that scamp model, that would be an effective trigger, right? So feeling really down and feeling depressed can be a trigger for trick. Um, so yes. Unfortunately. So when that happens, again, be extra kind to yourself. For example, remind yourself, oh man, I think I'm in a depressive episode right now. I'm just really not feeling good. No wonder I'm pulling more right now. This will pass. Let me think, what can I do to help myself? Let me do extra breathing right now. Let me go on a walk every day. Um, to try to help myself. Let me do an activity, even if it's at home. Let me watch a comedy, or let me engage in an art project. Let me do something to try to be kind to myself. I'm going to take a bath. I'm going to take a bubble bath. Um, right. So doing things to kind of help address the affect, the mood, will then help with your trick. So someone asked, "How can I stop pulling my hair?" Yes, this is the $1 million question, of course, right? And someone asked this earlier as well. So again, um, this is a chronic disorder. It is really, 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 really frustrating. So when you put pressure on yourself, how can I stop? You are more likely to continue because you are going to feel worse when you have slips. And when you have slips and you feel worse, you're going to be hard on yourself and then you're going to pull more and it starts this cycle. So instead, think about how can I manage? How can I manage my pulling? When you manage your pulling, you are more likely to decrease it significantly. Um, to a point that it would even be considered stopping. But I don't like to use the word stop. Um, Manage. Take that pressure off. Okay. And if you need additional help managing, again, check out the program, get support. I mostly have a general idle picking here and there most of the time, which I could live with. But the tough ones are where I have episodes of deep pulling, which seem to come out of nowhere. Yep. Why do they happen? And how can I see them coming? Yeah, that's what this disorder is all about, right? It kind of comes and goes. You can have good days and you can have bad days. So that's great that you're able to kind of live with and be okay with the little bit, with the little picking here and there. But yeah, when those episodes come out of the blue, gosh, it's so frustrating, right? And it can feel really discouraging. So what you can do is think about it after the fact, right? What happened, and try to figure it out. What was the trigger in that situation? Um, when you figure out that trigger, when you kind of sit down and think about what happened, you can be better prepared for next time. But there are a lot of triggers that are outside of your control, right? So think about it. What triggered the episode? Was it an external trigger? Or was it an internal trigger? Um, and how can you take that information and apply it for next time and prepare for next time the best you can? Sometimes you can't see it coming. Sometimes you can, but sometimes you can't. And I think the most important thing is after the fact, um, again, be kind to yourself. Um, don't put yourself down. It is disappointing. It is frustrating. But okay, you'll get it next time. Um, it's one episode. You'll get back on track. One episode can do a lot, um, which is discouraging. But again, it will grow back. You'll get back on track. I wear a scarf every time, but when I have the severe urge to pull my head hairs, I have to take off my scarf. Yep. Any other more better strategies? Yeah. So the thing about barrier strategies is, yeah, you could just take them off. So if you're using barriers as a strategy, um, you could use more than one barrier. So for example, having a scarf, but depending on where you are, but also having gloves on. So gloves on and a scarf, and maybe fidgets, right? And maybe rephrasing thoughts, um, and maybe changing your location, right? So it's a combination of things, not just one. Um, you can wear scarves super tight. You can also wear a scarf and wear a hat on top of the scarf, or wear, I like swim caps because swim caps are harder to kind of sneak underneath. Um, but that's not something you're not gonna wear in public. So that would be like when you're at home, putting like a swim cap on. Um, but yeah, so using multiple strategies at the same time. So barriers, fidgets, being aware of your thoughts, your feelings, and your location. Yep. So here's another question. We kind of addressed aspects of this already. I will repeat it though. I have been struggling with trick for so long. I tried CBT with no improvement. Could SSRIs work? So CBT is not the treatment for hair pulling for trick. The treatment for BFRBs, or specifically trichotillomania, is a combination of treatments. So it's all these treatments at the same time. So it's CBT, but it's also DBT. It's also the comprehensive behavioral model. It is also habit reversal training. It is also acceptance and commitment therapy. So doing just one of those things is not going to do anything. It's you've got to be using everything at the same time. Um, and as I mentioned before, um, there are no medications for hair pulling, so SSRIs will most likely not do anything unless you have a co-occurring disorder, um, in which case SSRIs could be helpful. Um, but no other co-occurring disorders, then most likely SSRIs will not do anything. And you can check out, if you want to go the medication route, you can check out NAC, but talk to your psychiatrist. Yeah, I tend to inspect for imperfect hairs that are not uniform. Yep, to the rest of my lashes and brows. Do you have any tips to not inspect for imperfections? Yeah, so this is really common. So this is that sensory trigger that we talked about. So you're visually looking and inspecting, or scanning. We could call it scanning. It's really hard not to look. Um, so one tip would be to prevent yourself from looking and inspecting is covering those mirrors, getting rid of mirrors, definitely no magnifying mirrors, post-it notes on mirrors, things in front of your mirror to block you from getting too close, dimming the lights around mirrors so you cannot see that clearly. Um, those are things to kind of help you not look so deeply. Um, Another strategy here is when you're noticing that thought, it is imperfect, right? What makes it imperfect? Um, See if you can rephrase that thought. So, for example, um, if the thought is um, that eyelash is darker color. And it stand that my eyelash, there's a darker color eyelash. It really stands out. It's ugly. It's gotta go. You would rephrase that with, oh, that's interesting. I am noticing one lash is darker than the other. How unique is that? That makes it look so beautiful and varied. So kind of rephrasing your thinking. So for here, I would say blocking mirrors and rephrasing your thoughts. That combination, something to give it a try. Oh yeah. So here, is it common to change locations on the body that you pull from? I started with my eyelashes and eyebrows when I was little, but in my late 20s, I started pulling from my scalp, which never appealed to me before. Yep. As I mentioned before, urges can travel. Um, so if you're managing one area, that urge is going to be like, oh no, I'm still here. Listen to me. I want to talk to you. Why aren't you listening to me? Okay, I'm gonna call you over here. So it's gonna find a way to get your attention. Um, so it does travel. Um, and it's again super frustrating when you feel those urges, that tingling sensation, or that desire in different areas. Think about what is it trying to tell you? What does it need? It typically means your body is missing something. So you have to figure out what is it missing. It's like it's speaking another language, and you have to try to figure it out. Yeah, I've been pulling for 59 years. Nothing has helped. What do they have today to help? So I don't know what you've tried, um, um, but there's a lot. There's a lot of things to help. There are a lot of strategies, and it's not just one strategy, it's a combination of strategies. So I suggest connecting to a trained therapist, whether it's in person and someone in your area, or whether it's through the Trick Stop program, so you can kind of have guidance and going through all of the different strategies and see what you've been doing and what has not been working and what adjustments need to be made so that you can find what does work for you. Um, if you want a therapist in your area, you can check out therapists. There's trained therapist listings on trickstop.com and also on bfrb.org. If you're interested in the program, all of the therapists in the program are all trained and highly knowledgeable and helpful. So that would be my suggestion. Okay. Ah, so someone's just clarifying a question from earlier. Can letters from a therapist or doctor help when asking insurance to cover uh, trick therapy or bracelets? Um, so you'd have to ask your insurance company if they require anything. If the keen is considered a medical device, um, if they would consider it a medical device, they would probably need a receipt and write in a doctor's, write a therapist note saying why you need it. And if that's what you need, from your insurance, if that's what they tell you that they need, yeah, a therapist from TrickStop would write you a letter saying that it would be helpful for you and necessary. Yeah, why not? Yeah. In terms of insurance covering therapy, um, as of now, I don't think, uh, well, the Trick Stop is not like an approved provider, um, meaning they're an out of network, but I know that they're working on it, but it's not happening yet. But they can provide you with receipts, so that you can submit to your insurance company. So maybe you can get a reimbursement. But email again support@trickstop.com, or if you're already connected to a therapist, talk to your therapist about that. Yep. So is it normal to have gray hairs coming out of your scalp in specific areas? For instance, if I pull my hairs from that specific area and on that area, 20% of my natural hair come out and 20% gray hairs come out. Any remedy to prevent gray hair? Yeah. So as I mentioned before, when hair grows back, it can grow back different textures and different colors. So yes, it can grow back gray. That doesn't mean it's going to stay gray. Um, it means just that initial kind of growth is gray, and it might, as it grows, become your natural hair color. So it might change. So don't feel too discouraged if an area is all gray. It might stay gray, but it also might not. Um, there is nothing you can do to prevent it. It's just kind of, it is what it is. Um, Also, depending on your age, I mean, gray hair happens. So it's normal. I've worn wigs for 55 years, but now that my natural hair has all grown silver, I'm finally taking them off. So now I wear different hats to cover bald spots. Do hats hurt or stop hair growth? Um, there's no reason why a hat would hurt unless you are keeping it on too tight. So just make sure there's like some air and some wiggle room in there. Um, no, hats are not going to stop any hair growth. You're not wearing a hat 24 hours a day. You're not like suffocating your head. So oxygen is still getting in there. So it's not going to affect hair growth. Yeah. How can I prevent my body focused habit from morphing into another type of habit if I stop pulling from my scalp? So, so this is a disorder. It's not a habit, which means it's harder to manage. It's harder to work with. Um, there's not much you can do to prevent it from kind of popping up in another area, except being aware. Being aware is so, so powerful. So as soon as, if you're managing one area and if you start to notice an urge in another area, um, like be aware right away, say, oh my goodness, I'm feeling a tinglingness in an area that I never felt before, and immediately like walk away, do not engage, do something else, change activities, right? Shake it out, splash water in your face, go on a walk, drink some water, lie on the floor, um, um, do something else. Um, so the best way I would say to prevent it from morphing into something else is when you notice it right away, do not engage. Because once you start engaging, the body's going to kind of be like, oh yeah, I like that feeling. It reminds me of this feeling. And then you're going to continue it. So do the best you can to avoid starting to begin with, just noticing it. Because yes, you will be more susceptible for it to travel. Okay. I think I think I got all the questions. If there are any straggler questions, type them in now. If not, feel free to email us at support@trickstop.com if a question comes up later. Oh my gosh, I have this question and I forgot about it, or I thought of this question. Just email us and we'll get back to you and we'll answer it. If not, we will be having this again. We're having these somewhat regularly. So come join again. Okay. And any further questions, comments, suggestions, again, just reach out to us at support@trickstop.com. And I really appreciate you all joining me tonight. And I hope this was really helpful. And thank you so much. And I look forward to next time. All right. Take care, everyone.